You know the story about the barber pole and how it represents the bloody bandages from the days when barbers were also surgeons? Well, it would be tough today to find a barber shop that offered medical services. Tough, but not impossible.
The neighborhood barbershop is much more than a place to get a haircut. It's where friends meet, gossip, and chat about everything.
Just don't go down the street and get some regular shrimp.
No.
No.
Right,
you know.
I'm getting a big shrimp.
Right, you know.
But in some shops in North St. Louis, the discussions have become a little more specific.
I think we all should go to the doctor a little bit more. I think we just take so much advantage of, the health part of it, but it's just so many things that's working inside when you get older that you really don't know about.
Thanks to some traveling physicians from Barnes Jewish Hospital, the topic du jour, healthcare.
We're just coming out to all the different barbershops just to do basic health information, blood pressure testing, give you guys information about healthy eating, healthy diets.
Dr. Sanjay Maniar and fellow residents set up a bare-bones clinic at various barbershops in North St. Louis, armed with nothing more than a stethoscope and blood pressure cuff.
I'm gonna try to relax now.
Calm thoughts. We set up our health fair, which is just basically us coming out and educating the patrons within the barbershop, providing free information, free health screenings, trying to get people information about the prevalence of diseases among African Americans within St. Louis.
Maniar and his colleagues began this program about 3 years ago, and despite running out of funding, they continue to make barbershop house calls. They want to reach and make an impact on a population that needs greater exposure to preventative medicine.
The mission is to identify a lot of disease and increase the overall awareness and educate patients who are otherwise who have limited access to care. Patients who have not been seen by a primary care provider in years, may not have ever been seen by a physician. And that's the group that we're trying to focus on, people who may not come into the doctor to get seen.
It's important for everyone to receive preventative health care, especially those in communities that are faced with health inequities, the difference in the quality of health and health care across different populations. Many in African American communities are more susceptible to chronic diseases, higher mortality, and poorer overall health outcomes.
There's a saying that's emerging: where you live matters, place matters.
Dr. Vetta Sanders-Thompson is an associate professor specializing in public health at Washington University. She attributes these health issues to socioeconomic status, because socioeconomic status often determines place.
When you're in a city like St. Louis or a region like this region where you have older houses, there is lead, but we've been dealing with that issue better, but we have indoor pollution that people have to cope with. We have outdoor pollution.
It's a complex set of issues. A lot of older urban neighborhoods lack access to fresh and healthy food choices, safe options for outdoor activity, have an increased exposure to violence, and are exposed to more harmful pollutants.
All of those things are things we don't think about, but people who are poor, people who make more use of public transportation, you've got more exposures. Those things will make a difference.
The reasons Dr. Maniar's target audience may not receive preventative health care are many. They don't have insurance, they're accustomed to only seeing a doctor when they're sick, and just like many areas in St. Louis, there is a deep history.
When you think about health in St. Louis, you have to go through the sequencing of health care for, in this instance, African Americans.
During the Depression, Homer G. Phillips Hospital was built to address the subpar medical care for the city's black residents. A segregated black hospital, it became the premier training ground and employer to black doctors and nurses, and was a source of pride for the black community. In 1979, city officials closed Homer G. alienating an entire community.
You know, the loss of Homer G. Phillips, the loss of the city hospitals created barriers to healthcare access.
I just took it this morning. It was 180 something over 75. 180 something over
Still
75.
high.
That's high.
It's still high.
Still high.
Breaking down those barriers is exactly what these physicians are trying to do.
I think among a lot of inner city communities, there's a lot of mistrust of physicians or the healthcare system. People usually identify just bad outcomes with the hospital. You got to get something that's quick, right? And so that's when you end up getting a lot of fast food, right? A lot of times it's just, you know, showing that you care and showing that you're willing to be a part of the community in order to try to make a change within the community.
One person at a time is
One person
success.
at a time, you know, it's like, you know, little by little the lot will be won. So it's just, you know, taking one step at a time to try and reach as many folks as we can.